Medicaid. We are going to extend Medicaid for the working poor and for those who are jobless trying to find work. We're doing this for a variety of reasons. And this was a decision that I had to consider over a long period of time. Number one, many of these people who are below the $14,000 in income, some of the poorest Ohioans, they get their primary care in an emergency room. Now, that is not the best way to get people primary care. Not only is it not good for them because it doesn't allow them to get healthy, but secondly, it drives up the cost of everybody's health insurance. When they visit these emergency rooms and cannot pay, we all pay for them. And I don't think that is a sustainable way to do business here in the state of Ohio when it comes to health care. In addition to that, extending Medicaid also means that Ohioans will recapture over the next 7 years $13 billion in our money to help these working poor and those searching for jobs to be able to get health care in a consistent way. And when we look at what Greg Moody's been able to do with coordinating care in Medicaid, he's been able to bring about significant savings in that program. Because when you coordinate people's care, it's more rational, and ultimately it brings about greater value for everybody, including the taxpayers. In addition to this, there will be a time when the federal government will no longer reimburse hospitals for this uncompensated care. If we were to reject extending Medicaid, I believe that we would create financial chaos, particularly across our rural hospitals, our rural health care delivery systems, because they would no longer be able to get reimbursed for the care that they provide, and would create, in my judgment, a financial mess. In addition to this, many of you know that I have really wanted to work hard at restoring the safety net for the mentally ill and the addicted. The fact is that extending Medicaid is going to significantly allow our local providers of both mental health services and addictive services with some space and some opportunity to begin to rebuild that safety net so that we don't find as many of our mentally ill in our jails today because they receive no care or living under a bridge. It's not acceptable in a big state like Ohio, a major powerhouse in the United States of America. So we can move forward with that. Now, I, as you all know here, am not a supporter of Obamacare. I don't believe in the individual mandate. I don't believe in the collapsing of the ratings of our insurance industry. And as you all know, I decided to move forward with a federal exchange rather than a state exchange where I believe we would have lost control. But I think that this makes great sense for the state of Ohio, and it makes great sense for the state of Ohio because I think will allow us to deliver care using our dollars to people who, up till now, haven't either been able to afford a care through their job or they weren't able to even find a job, and they're extremely poor. Now, there's a wrinkle in all of this that you should be aware of. I have been working on a program to try to bring some flexibility to the way in which we provide this coverage. Let me say in the onset, regardless of what happens, I believe we need to extend this coverage, this health care coverage for Ohioans. Right now, you have to extend up to 138 of poverty. I felt that we could get some flexibility, and I talked to several of my friends in the Democratic Party who have great influence inside the administration. And I told them that I felt it was possible, if we could get some flexibility, to bring the country together in terms of this issue. There was great difficulty in being able to coordinate a letter among people in my party, and there also was, over time, almost dead silence from people who were close to the administration. Last Wednesday night, I received a call from Valerie Jarrett, and I said to her that, Valerie, we You know, I'm inclined to expand Medicaid, but we need some help out here in Ohio. Friday night, John McCarthy came to our budget meeting as we were preparing and said that there is a discussion now about some flexibility, about the possibility of those between 100 and 138 their possibility of their being able to buy onto the exchange to receive private insurance coverage. I want to thank Valerie Jarrett today for being willing to work with us. Now, I want to be clear to you. We don't know what the details of this are going to be yet. We don't know what the cost is going to be for buying into the exchange, although it appears as though they're willing to waive budget neutrality in this case. They've worked with us before on achieving a dual eligible waiver. We're one of only 3 states to get it, but I've got to tell you, it took us 6 months to get that done. I don't know where this is going to lead us, but I believe that these motions that lead us towards a more flexible way to accomplish this is positive. But I want to be clear. I don't know if it'll be workable at the end of the day, but it does give us a chance to explore other options to accomplish our purpose more consistent with what we think is in the best interest of Ohio. And we will do what's in the best interest of Ohio at the end of the day here. But again, I want to thank the administration for a willingness to enter into discussions to achieve a common goal, and that is the ability to provide coverage for those who are working, who are poor, and allow us to better run our health care system.